Tonight's going to be really important because this is what you all wanted. So you guys saw the post, and listen, I'm going to let you all know right now. Hey, Patty. Hey, Tyler. So listen, if there, I want you guys to think if you don't hear something that I talk about that you have a question about, I try to go through that post and get them all. But if I miss something, make sure and let me know. All right, send me just all when we get done. I'm going to look at questions and see if we missed anything. Now, because there were so many things that are very similar, I organized I organized everybody's responses to where they kind of combined a little bit because some questions are fairly similar. All right. So, I'm also going to tell you guys this. As I'm going through these, I read through them and I wanted to kind of be a little bit spontaneous because it's the same way as like in the office when a patient comes in and they say this or say that. I have all these responses because I've been doing it for so long, and I wanted to be the same thing here. But my response, my answer to a lot of these things are going to be very similar. There's a very similar thread and tone to the way we respond to these things. So what I'm going to do, I apologize. What I'm going to do is I'm going to go through these questions. I'm going to answer them, and then we're going to. It'll kind of reveal itself, but then at the end, I'm going to tie it together. There is an overall attitude, best word I'm coming up with right off the top of my head, that we have to approach all of this with. But let's see, what time is it? We got 7:03. We're 3 minutes in. All right, you guys ready? Let's just go ahead and get started. For those of you that you're already jumping on here. All right, so here we go. So these are the challenging patients. These are the questions. These are the conditions that create challenges within our practice, and how is the best way to handle it. So we're just going to get in the middle of it. We're going to start. So number one, difficult patients. The difficult patient is one who comes in with an advanced problem, which has been there for a long time and expects it to go away in a short time and then quits after a couple of weeks. All right, let's address this. You got a patient, and then the question was an advanced problem. Well, we need to first determine what that actually means. And again, I know I'm going to be repeating myself over and over and over, but the advanced problem, how long it's been there, is really irrelevant. It is not your responsibility if it's acute or advanced. It doesn't matter. NA's going to do the healing anyway. So with this patient, the one who comes in, and let's say we're going to rename advanced, or we're going to redefine it as been there for a long time. An older patient that's had this forever and has been there for a long time and expects it to go away in a short period of time. I'm going to say that if that is the case, then right in the beginning, during your consultation, you dropped the ball. I had a patient today. Here's a perfect example. A patient comes in today. It's the husband of a patient that she's been trying to get him in for years, and he had lived in one part of Oklahoma City, or kind of Oklahoma. Now he's in another part. He's been to several chiropractors, and I know a couple of them. They're great guys. And he's coming into me, and I did a full set of X-rays. And you should see. I wish I had taken pictures of him for an example. His neck has. You know how we normally see like osteoarthritis or bone spurs or whatever on C5? The only bone that didn't have degeneration on it was C1, C2. The only ones. Everything else was a train wreck. And so mid back, same way. Lower back, he's got a spondylosis. He's got a bone spur about the size of my finger. Advanced, right? I told him during the consultation, right in the front, listen to me. You've had this for a long time. You told me that. And you told me about all the problems you're having. And you've seen other chiropractors. I'm just going to be honest with you. This is not about how you feel. Your pain and the condition, the things that you're feeling are really irrelevant at this point. What we have got to address is what your spine will look like, or the potential of your health in 10 years. Now, we have a decision to make. We can either address that appropriately, or You can go back to feeling the way you are, or I can give you Advil, a shot of tequila. You can have a great day. And he kind of started laughing. I said, are we on the same page here? This isn't something that I can snap my fingers and correct. We're going to have work to do. Now, I'm going to spend time with these x-rays, and I'm going to make sure I didn't overlook anything. But when you come back tomorrow, well, doc, I can't come in tomorrow. Okay, then I'll see you Monday. But when you get here Monday, I've got news for you. I'm going to break this down. We've got work to do, and we're going to have to be committed, or I'm not going to be able to help you at all. Right? So you see what I'm getting at, gang? Right off the bat, I did not allow him to dictate whether he was going to come or not. Now, we're going to go ahead and address this. If he doesn't follow through, if he doesn't come in a couple of weeks, I don't care. I do not care. I told him the truth. If he shows up, I will deliver on the truth. Whether he shows up or not is not my responsibility because I told him the truth. That's the secret. If you are very direct and you're very vocal and you are very crystal clear on your message and you tell them the truth, now it's out of your hands. But if you don't tell them the truth and you dance around it and you're not clear or articulate with your message, now that is on you. Okay? I hope it makes sense there. The difficult patient is the skeptical husband or wife of a patient who is there just to prove me wrong. I love these. Again, who cares? Who cares? It is not, it's I'll give you two scenarios. One, patient comes in, she didn't want to be there, she was mad that she was there. I ignored all that. I did what I did. After the consultation, she went home. She put 3 of her neighbors in the car, brought them back, brand new patients that day. Another patient is a friend of a patient, wasn't a husband or wife, but a very close friend. She is one of the wealthiest women in Oklahoma City. She comes in, and I give her the report of findings, and she crosses her arms, and she says, well, my mother is up here at McBride Clinic. What makes you think you know more than they do? I walked over and opened the door, and I said, I don't, ma'am. I said, maybe you need to go to McBride. And she walked out, and I never saw her again. Hell no. Hell no. Listen, they walked in your office. They are on your dance floor. You are the leader. You are the captain of your ship. You're not trying to impress anybody. You're not trying to educate anybody. You're not trying to convince a soul. Listen, your name has doctor in front of it. You are educated. You know what you're doing. If they don't want to buy into that, if they don't want to listen to you, if they just showed up to your office because they don't have anything better to do than try to argue with you, it's very simple. You look at them and say, ma'am, this is not a debate. It's only my job to tell you. And then you shut up and you let them make the decision. This type of patient is my favorite because I don't allow it. That's the secret. How to take one of the challenging patients, how not to take one of those challenging patients personally, especially when you've done so much to accommodate them, time, energy, care you provided. That's your own damn fault. All this time that you spent to accommodate and all your energy and all your care, why did you spend so much more time, care, and energy on that one than everyone else? And maybe you didn't. Maybe you didn't. But here's the thing: if you are taking it personal that you spent so much time on all these things, right? Well, then that's your fault. That you can't blame the patient for that. You're the one that wasted all that time with them. Don't fall into that. Listen, you're not a victim. Listen, I'm gonna be hard on you guys, and I think this is appropriate. How not to take challenging patients personally? It's not about you. It isn't about you. Look, what did I sent that message today. I posted that about do not. What you are, we are artists and we perform our art, we articulate our message, we love for the sake of loving, we adjust for the sake of adjusting without any concern of the outcome. Remove the outcome from your intention and you're going to be amazed on the difference it makes, and that difficult patient will go away because they won't be difficult anymore. Because you can't take it personal because it's not about you, and you can't take it personal because you didn't spend so much time to accommodate them, right? I had a young doctor reach out to me. She's not in the group, but I've known her forever. She reached out to me and said, Doc, I got a question. I had a lady that was like a grandmother to me, and she asked me if I would come to her home and do exercises with her husband because he had a stroke, and then I did, and then he said something inappropriate. How do I handle it? I had to say, well, first of all, you don't accept anything inappropriate, but you put yourself in that position in the first place, right? They either come to your office. You're not a traveling physical therapist. You're a chiropractor, so I'd have that talk. But I hope you guys are getting my point, okay? Now, compliance and patient issue and commitment issues. The patient that comes to start treatment never finishes a care plan, comes back over and over, doesn't want to commit to care. They're nice enough to not overly irritate you, but still won't listen to your recommendations. Who cares? I've got lots of them. I got lots of those patients. I don't care. If a patient comes in and I say, Jerry, I need to see you 3 times a week for 8 weeks and once a week for 8 weeks, and then we're going to have a conversation about maintenance. All right, doc. And he leaves. And this is Monday, and he doesn't come back to him the following Monday. I'm going to look up and see, and I'm going to say, you must have been busy this week. Yeah, I got a lot going on. I adjust him, and I say, I'll see you tomorrow. I give the hand signal, and he leaves. Whether he comes back is not my issue. Gang, stop. Listen, you're going to have to remove yourself from the outcome. Now, listen, don't get me wrong. If every single patient, I say you do 20 reported findings and no one's coming back, okay, well, then now you need to look at it and go, something's going on. But we're talking about the difficult patient. We're not talking about all of them. If they're not coming back, if you are training, if you're watching the videos, if you're watching these videos in the foundations, if you're actually getting on and watching them, taking notes, listening to it, articulating your message, working on it, training, going in and delivering this message. If you're doing that, and here's the thing, I've got to say this to you guys. Listen to me. I've got to believe that if X amount of you are watching the videos, Amy Van, you're a perfect example. Tyler, also down in Springfield. Gosh, there's so many. I'm not going to name you all, but there's several of you that I can name that you watched the videos and you took the information and you implemented it, and painful, follow through. If they did it, well, then it works, right? If it's not working, then you need to take a step back and go, my energy, my tone, something. But this patient that starts and they just come in when they want to, I've got so many of those up to 30 years, I don't even reschedule them. They come in, hey, Jerry, it's great to see you. Face down. I adjust them, I open the door, let me know if you need anything, is all I say, and they leave. I'm not going to spend any time with them. I'm not going to play that game. I got too many other people. And what's happening is if you give this energy, which you are, or I wouldn't have the question, then you're not giving the energy to the patients who deserve it, right? The patient who never follows your lead, the one who never complies with 3 times a week, wants to pay per visit and only uses what insurance covers. Educate them seems to lead to more frustration and progress. Can I just use my insurance visit? Yeah, just my job to tell you. I've got a young lady, Karis. She is adorable. She graduated with my son. She is an ER nurse. She's a little ER nurse. She's like a CrossFitter. She's just adorable. She comes in on Monday because that is the only time she can come in. She works 6 to 6. No, I take it back. 7 to 7. 7 to 7, Tuesday through Saturday. She has Sundays and Mondays off. What are you supposed to do? Tell her no? So here's the thing. If she absolutely can't, and you're good with that, well, the patient that actually won't, well, then be good with that too. It is not up to you. It is not your responsibility your only responsibility is to open the door, tell them to lay face down, adjust them where it's appropriate, tell them what's best for them, and move to the next patient, all right? Those who don't agree with your plan and where you don't have x-ray, okay, so this is a good one. Those that don't agree with your plan, and if you live in a place that you can't use x-rays to communicate what's going on, that's too much for me. They don't start care, or they start, but they do their own plan. How do you get them to value as much as we do without x-rays? So this is something, I've got to fly here. This is something that I've talked to a lot of you about, and I want you guys to think about something. They got in their car, they drove to your office. A lot of this I know. This is our patients in the Netherlands. This is our sweetest our doctors in the Netherlands, our doctors in Sweden, doctors in other parts of the world that you're not able to utilize X-rays. But I want you to think about something here. They got in their car, or they on their bike, or they walked. However they got to their office, they made effort to come to see you. Why? Because you're a chiropractor. It says Dr. Whoever on the door. So they assume that you are educated. They assume that you know what you're talking about. And then if they didn't want to believe you, they would have never showed up in the first place. They will only believe you as much as you do. So I'm going to tell you that this patient that doesn't want to agree to your plan, again, here's the statement. I understand. This isn't a debate. It's only my job to tell you what I think is best for you. With my experience and my understanding of the human spine, from what your spine and this exam is telling me, this is what's appropriate for you. You came in here with this list of symptoms. I know that those symptoms are a result of nerve interference caused by stress in your spine. From what I can tell from my exam, the stress is where I showed you. If we don't remove that stress, I do know for a fact that it will only get worse. Now it is up to you to decide whether you want me to help you or you don't. You have, and it's not trying to teach them anatomy or sell them. I don't sell anybody anything. You either want what I have or you do not. Now here's the problem. So many of you are using these social media marketing campaigns, and I get that. And the only reason they came in is because it was cheap. I don't care. I don't care how they showed up. I don't care if they were in a car accident, a neighbor referred them, they fell down and looked up and saw your sign, or they got a Facebook post. When they walk in your office, it is your dance floor. You are the doctor. You are the expert. You are the professional. You are the master of your art. I just have a hard time believing. I want you guys to think about something. I know this is a weird analogy, just kind of jumped in my head. Let's say I have a new kind of a coach mentor that I just started working with, and he is a kung fu master as well as a master of many things, and he ran a kung fu school for a long time. And I have a hard time believing that people would go to his school and stand in front of him and debate him on these things. Or if he tells them that this is what I want you to do to improve your skill level, or improve your balance, or to improve your way of thinking, which he's working with me a lot. I have a hard time believing that anyone would debate him at all. And if they did, I know exactly how he would respond. He would smile. I appreciate your opinion. I appreciate that you felt that it was important to voice your opinion. But I also appreciate that there's the door. You can walk out of it with the same energy and intention that you walked in. You have a decision to make. Okay? You almost have to take that same approach. You are the master. If you don't have an x-ray, but you did your exam and your palpation and you know this is what's best, tell them that and then be done. Don't educate, don't sell. Okay? I hope I answered that. All right? Okay, next. How do you handle the patients that are just downers in the office, bringing down the energy with constant complaints about chronic issues not resolving in the first few weeks and doubts about care? Again, I told you guys this is going to be the same thing. First of all, right off the bat in your consultation, you've got to make it crystal clear. You are not about symptoms. You are not about, I do not want you to have these symptoms. I do not want you to have pain, but I'm not here to get rid of your pain. Excuse me, gang. I am not here for that. I'm here to restore the proper motion in your spine and give your body the potential to heal itself, right? That's what it is. If they've got low energy, and you're having, and they're downers, what that means is you're allowing them to bring you down. No one brings me down. That I love this. I love this saying. Well, they made me mad. That patient come in and they just aggravated the hell out of me. They just made me mad. Really? I didn't know that you were so weak-minded that another human being could control your mind like that, that they made you do something mentally. Right? That's exactly what it is. If somebody brings you down with their energy, that's because your energy isn't high enough. Heather Van Wyk, I love what you said here recently. My energy is so high that they either have to rise to it or they don't want to be there. Gang, listen, it's just kind of hit me. That's Focus Foundations. Do you guys realize how many people have joined this group and they don't want no part of it. They're victims and they're negative and they can't let go of the past traumas or whatever it may be. And they don't like how positive we all are. And then I've had people that have brought that negative energy into the group that I've asked to leave. It's not the right place for you. I will protect what we have here with everything I got. My energy will not be brought down by anyone, ever. And if they're bringing it down in your office, you're allowing it. Don't allow it. Don't let your staff allow it. Don't let anyone allow you to bring your energy down. And if they're complaining all the time, and there's some other questions about this that they're going on and on, simply listen. Simply listen. Here it is. The patient who gives you a laundry list of symptoms before getting on the table every visit. Hey, Brad Schaefer, what do we say? Let's check it. Let's check it. It was funny, I knew that we were going to have this tonight. I don't know, probably a dozen patients today. They're going on, and I just let you look at them, dead in their eyes. Listen. Just listen. And then what you're going to do is you're going to say, let's check it. Motion to the table. Or it's this. I know exactly what that is. Let's check it. You know what? I've seen that earlier. Let's check it. And then you just adjust them. If they got a lower back on the right and they've been complaining of something else, then let's check it. Don't talk about it. Don't engage in conversation, ever. I don't engage in conversation. If they tell me all these things, well, I got this. I just listen. I don't say nothing. Well, what do you think that is? I'm not sure. Let's check it. Well, Doc, I feel worse than I did yesterday. I understand. Let's check it. Well, I've got this, and this. Okay. Well, let me check it. That's it. That is it. That is all you have to do. I promise you, that is all you have to do. All right? Let's go to the next one. Did you get it? Can you recheck it? It still hurts. The 15-minute patient. No. Whoever wrote this question, there is no such thing as a 15-minute patient. There's a 15-minute visit that you allowed. Did you get it? Yes. Are you sure? Yes. That's what it needed. It still hurts. I understand you're still healing. It's 10 words or less. I want every one of you. Now listen, I'm not going to take credit for that. There's many of you that are on here that knows exactly where that come from. That was an old Pinnacle statement that Steve Hayes used to say. And I'm going to give credit where credit is due. He used to have a thing. It was a thing we worked on, 10 words or less. And I still try to incorporate that. Sometimes, though, listen, sometimes it is appropriate. Now, if it's an appropriate discussion, Dr. Young, I've been taking this high blood pressure medicine and I just feel like crap. What are your thoughts? Okay, well then address that. I've been, I've got every ache in every joint and bone in my body aches. I ache all over. Well, you guys know as well as I do. If they're aching all over, that's systemic. That's something different going on. Then I'll simply say, by chance, what medications are you taking? A cholesterol medication? Yeah, they've got me on whatever the cholesterol medication is. Okay, well, I have a feeling that might be what's causing it. Okay, address appropriate, but just the complaints, just the yuck. No, there is no such thing as the only 15-minute visit is the one that you allow. Okay. All the other chiropractors in the area are charging $29 for the first visit, X-rays and exams, adjustments, reported findings. Why are you so expensive when you're doing exactly the same thing? I love this question. I had it a while back. Doc, I went to another doctor and he didn't even take X-rays and then he only charged like $19 a visit. I understand. I said, but you're here now. And you get what you pay for. You get what you pay for. It is very, very simple. It is not the same thing. If it was the same thing, you would be there, not here. You get what you pay for. You do not, under any circumstances, allow anyone to debate you on what your fees are. If they go to a Hyundai dealership, it's a car with 4 wheels and a steering wheel, or they go to a Mercedes dealership. Well, why is Mercedes so much more expensive than the Hyundai? It's the same thing. Is it really? No. Listen, this is going to sound like arrogance and ego. It's not. You guys are focused, foundation, chiropractors. You are the masters of your art of articulation, your art of communication, your art of technique, your art of understanding. No one is doing what you do. And here's the thing. If what the others were doing, if this $29 first visit was so amazing, why are they in your office? Make it very simple. Do not educate, do not debate, do not sell. I understand it is not the same. You get what you pay for. You will get more for your money here because I am more. Simple. Make it simple. That's it. That was quick. You really churn them in and out, don't you? Absolutely. Isn't that wonderful? I say it all the time. I'll say, isn't that great? And I'll tell patients, well, you get them in and out. I tell you what, your time is precious. I don't want to waste your time. I'm pretty sure you got things to do, don't you? Well, yeah. Everybody will do that. I will say that just on a regular day. I'll adjust them and set them up. I'll say, all right, sure you got things to do. Oh, yes, sir. That's another way of saying I'm done. But I'll tell them, I know you're busy, and I'm not going to waste your time. I want you to get back in the middle of your day. Go, or I'll just simply say, go have an amazing day. But if anyone says anything about how quick we're moving, I go, isn't it great? Listen, it beats being at your medical doctor waiting for an hour. Well, you got a point there. I kind of figured that you're busy. You've got things to do. My job is to see to it that you can continue to do it. Yes, sir. I've told this story a dozen times. I'm going to tell it again. I had one of the most successful businessmen that I know, a huge company, but a country boy, good old country boy. He didn't want to come in. His wife was coming in, and his wife talked him into it. He had a problem with his neck, complain. She said, do not speak to me until you go see Dr. Young. So he comes in, skeptical, didn't want to be there. And he was one of those guys that time is money, man. Time is money. Let's go. He was one of those guys. Did the consultation, exam, comes back the next day, the report of findings. After the report, I adjusted him. He came in on the third visit. So just a regular visit the first time. He lays on his back. I adjust C5. I help him up, and he goes, "Is that it?" And I said, "Yes, sir." And he looks at me and he grabbed my hand. He goes, "I like your style." And man, out the door he goes. Danny never misses, ever. Right? So I love those patients. And when they say that, man, you celebrate that. That means you're doing it right. Okay? I left the other chiropractor in town because I started just to feel like a number on an assembly line. Are you going to treat me the same way? Absolutely not. Now listen, gang, this is important. This was an important question. I won't tell the whole story because I've told it so many times, but it goes to the point. A good friend of ours who was seeing a chiropractor in South Oklahoma City that I knew really well. And then she started coming to see me, and we were out to dinner, and she said, "I like going to Tim because he spends more time with me than a guy down south." And her husband, which is one of my best friends, said, "No, Julie, Tim spends half the time. Matter of fact, he sees you and me and half the time that he just sees you." No, he rushes me in and out. Tim spends all kinds of time. Why does she feel that way? Present time consciousness. PTC, present in the moment. So when this patient asked me this, absolutely not. Zarek up in Amsterdam, up in The Hague. You and I had this conversation. Zarek had this very thing happen. Patient asked him exactly the same thing. And he said he adjusted her so quick, one of his fastest visits. And she looked at him and said, "That's exactly what I'm looking for." Gang, do not get caught up in people's perceptions. Here's why I left the other chiropractor in town, because I started just to feel like a number, because that chiropractor was treating her like a number. There was no there was no presence. There was no focus on the adjustment. There was a gross manipulation, some bullshit conversation, and out the door. Don't be that. The patient that prepays for all their care feels better after a few visits and wants a refund. Write a check. Write a check, hand it to them, have the girls hand it to them, and move on. They are not worth your energy. They're not worth it. If they don't want to, if they feel better and they don't want to come back, write them the check. If you don't, they'll tell everybody they know. If you do, you're going to be respected, and they'll tell people that you're a good guy, and he immediately get my money back. It's not worth the effort, gang. Just write the check and then forget it. Forget it. Okay? Here was some fun ones. My doctor told me not to see a chiropractor. I love that. I've had a couple of those here recently. Not to see a chiropractor, but my doctor doesn't want you to crank on my neck. And I start laughing. I said, well, first of all, I don't crank on your neck. Second of all, if you was to ask your doctor to write a paragraph on what it is I do, he couldn't do it. He has no clue. I'm not gonna, I'll do what you want me to, but I'm the trained professional in my profession. He's not. So you let me know if you want me to do what I do, or if you want me to do what he wants me to do. I just ask him. And here's the thing: if the patient goes, well, let's just leave it alone. Okay, sweet. Quicker visit. Thoracic lumbar out the door. I don't care. I don't care. I have no anticipation or worry of outcome. I just don't. So let it go. Don't listen. Do not get offended by it. Do not get offended by this. If you get offended, you're taking it personally. It's about you, and it's not about you. It's about the patient in front of you. They don't want you to adjust their damn neck. Leave it alone. If my doctor says don't see a chiropractor, laugh. Not like an idiot, not like a psycho, but just go, I get it. I get that sometimes. Isn't it crazy? And I'll say, I guess the problem is that, we're getting people well and they don't like that. We're taking business away from them. Well, that's what I thought. I tell you what, let's not worry about him. Let's just worry about you, face down. Gang, nonchalant, calm, and relax. If you get bent out of shape about it, you just look like a psycho idiot like the medical doctor does. All right? The client, the patients who have had a bad chiropractic experience in the past and say, they cracked my neck and it really hurt. You're not going to crack my neck, are you? No, ma'am. I don't crack necks. I do not crack necks. What I do is I look for stress in the spine, and I'm going to specifically put motion back right in that area. Let me do what I do, and then you let me know what you think. Do not let another idiot chiropractor that twisted someone's neck dictate you. Don't be afraid of it. Don't worry about it. Just do what you do. One of my favorite patients is someone who's been to an activator doctor and they want me to use activator. I will not even pick. You know what? I don't know if I think I played with one time. I won't even put one in my hand. It's like smoking to me. I'm just missing. Listen, you activator doctors, do not be offended. I'm just being me. I'm telling you my opinion. Do what you use it how you feel appropriate. But I'm going to tell you something. When someone's smoking, I don't want to watch them. I don't want to watch them do it. I will not hold a cigarette in my hand. I won't hold a cigarette package in my hand. It disgusts me that much. I won't do it. I don't want to be a part of it. I don't want to use activator. And so when somebody says something about activator, I kind of just laugh. I'm like, I tell you what, let me do what I do, and then you tell me what you think. Well, okay. And then I'm going to adjust them like I adjust anybody else. I've been in practice 30 damn years. I am a trained professional. I am a master chiropractor. Don't tell me what someone else did. If you wanted that, take your ass back there. Okay, I'm off my soapbox. All right, migraine patient getting results at 4 weeks, but says, my MD says it's okay to see a chiropractor, but I should never have my neck adjusted. Again, you say, well, let me ask you a question. How's your migraine headaches? Well, they're gone. All right, then I think we need to continue what we're doing. And then, well, you know what? I think I'm just going to skip the neck adjustment. Okay. Done. Quicker visit, easier. You save the energy. If you save the energy on the adjustment, don't waste it on worrying about it. Right? You lost that opportunity. Okay, let it go. All right. The over-medicated patient who's all on lifestyle drugs like statins, blood pressure meds, painkillers. Have you addressed the detrimental effects on healing or just ignore it? I do not. If they ask me specifically, if they say, Doc, what do you think about cholesterol medication? I think it's the biggest scam other than vaccines on the planet. And I used to carry, and I ran out of them. I used to carry Jack Wolfson's books, paleocardiologist. He's Jack Wolfson. If you guys, he's a cardiologist. I used to carry his books, and I just give them. I said, here, read the first chapter on cholesterol, and then you let me know what you think. But if they don't ask me, I don't address it. I'm a chiropractor. I'm not a pharmacist, and I'm not a medical doctor. They made those decisions. I didn't. But if they ask me, I'm going to say, well, listen, if you will continue to keep up with your care and we remove the stress from your nervous system and your brain starts communicating to your body, there's a good chance that you won't even be needing these things in the future. And then be done with it. I don't address it unless they ask me. If they ask me, I answer it very specifically. I don't give them an education. I don't try to sell them. I just tell them the truth, 10 words or less. All right? Elderly patients who with significant spinal stenosis, minimal joint motion, and multiple health issues, how do you manage expectations so they understand that the body does the healing, but they just want to feel better because the medical model has failed them? Listen, study, we all, you know what, I think what I'm going to do, I think I did this once before, but I think I'm going to do it again. I think what I'll do in Kansas City, we'll address it in one of our next Tuesday Night Lives, the 33 foundations. And one of them that we're going to spend a lot of time on is limitation of matter. Limitation of matter, and then we also have to spend a lot more time on, you're going to be talking about it a lot, we are all going to have to really start practicing and mastering the art of no expectations of outcomes. We're just going to have to, all right? We're going to have to work on that. And so with the elderly patients, you don't promise them anything because it would be a lie. You simply say, I'm going to do everything I can to restore the motion back in these areas. Let's give your body a chance. That's it. And then if you do that, I have got so many, my gosh, that's what Krista said at our lunch today. She said, our Medicare checks are about are starting to get about as much as our Blue Cross Blue Shield checks. We see so many Medicare patients, and they just never miss. Every 2 weeks, they've been coming to me for years, 20, 30 years. I never told them I was going to fix them. You can't say that. And I know they want to feel better, but all you have to do is say, listen, I understand. With the arthritis and degeneration in your spine, what we're going to do is that we're going to try to get as much motion in these joints as we possibly can. I want to give your body an opportunity to do its job. Let's do everything we can. And then you just adjust them. And do it with concern, do it with focus and intention, and put motion in it. Don't cause harm. Step out of the way and tell them when to come back, gang. That's all you can do, okay? The elderly with surgical joints, replacements, managing same thing. Look at the knee replacements, and I've got so many of those knee replacements and hip replacements and shoulder replacements. They know. Here's the thing, gang. You have to understand this. Your elderly patients, they don't expect much from you. Hell, they've been failed by the medical profession their whole damn lives. They go see an MD, they get rushed in, brushed out, a handful of drugs. They don't get touched. They don't get anything. At least you're putting hands on. They don't expect you to be freaking miracle workers. They just expect you to care about it. Just do that. And your expectations, remove it. You're just going to have to remove that, okay? I hope that makes sense. All right. Is there anything I should be doing at home or other therapies? I just don't feel like this is working. 3 visits in. I don't think it's working. We've only been here 3 times. If you went to the gym 3 times, would you be in shape? Well, no. Well, this works the same way. Doc, is there more I can be doing? Do you have any exercises for my lower back? Well, your lower back's not weak. You've been using it your whole life. Your core is probably weak. Go on YouTube, put in core back exercises. You're going to get 100 videos. It's going to teach you to do it better than I am. They won't. Doc, there's any exercises I need to do for my posture? Yeah, go on YouTube, put posture exercises. Watch those videos and do those. Okay, Be done with it. They're not going to listen. I don't give them exercises. I don't do all that crap because they're not going to do it. If they were wanted to do it, they'd have already been doing it, right? Listen, we've got this damn thing in our hands. They can YouTube how to put a dryer vent in. They can YouTube how to change a battery out of a remote. You don't think they know how to YouTube what exercises to do? They're not going to do it. So you guys have just got to understand where these people are coming from, and just 10 words or less is just like, give them a simple answer, okay? All right. Wow. All right. So, how do you keep on schedule? I get questions all the time about care plans or symptoms or even what's going on in their lives. I try to pre-frame it, but can't keep pace without interruptions. That's you. And you, listen, I'm going to be honest with you guys. I've mastered it through the years. But I'm going to tell you that it starts with the consultation, then the exam, and then the report, and then their very first visit. You do not initiate bullshit conversation. And then if they bring up bullshit conversation, you do not participate. Listen. Just shut up and listen. Listen to them. Okay. Well, I tell you what, have an amazing day and I'll see you tomorrow. And open the door. Or as they're talking, open the door. And keep listening. Let them tell everybody else too. You've got to train them that why you're there. But if you participate in the conversations, but and you know the questions about the care plan, if you have to listen, Doc, you said I got to come in 3 times a week for 8 weeks. Yes. Well, you know what about you know can I drop it down to twice? You can if you want to, but you're just inviting failure. What's best for you is 3 times. It's like going to the gym. Is 3 times a week better or once a week better? Well, 3 times. All right, well, I'll see you tomorrow. Gang, listen. Articulate your message. Do not try to educate. Do not try to sell right in the beginning. Just simply tell them where they understand. Listen, Denise. Listen, Denise. I need to see you 3 times a week, just like going to the gym. Okay? For the next 8 weeks. 8 weeks because if you break your arm, that's how long it takes a bone to heal. This is a healing process. 3 times a week for 8 weeks. That is what's going to allow your body the opportunity to heal. Do you understand, Denise? Yes. Okay, now listen. When you take braces off your teeth, you have to wear a retainer after that, don't you? Yes. Because if you don't, you'll have to put the braces back on and start all over again. Denise, I don't want to start all over again. So what I'm going to do is see you once a week, 6 or 8 visits. Once a week, 6 or 8 times. We call these retainer visits. Because Denise, I don't want you to start all over. Do you understand? Yes. They get it. They get it. As long as you tell them the truth. Okay? Would you change procedures or communication? And if so, how? If you practice in an area that is allopathic dominated, both in public perception and the job market. Also, in a world where people expect quick fixes, how do you overcome society's expectation for rapid change? I read this and had to take a deep breath. I'm going to read it again. And you're asking me, would I change my procedures or the way I communicate if I practice in an area that is more allopathic dominated? Oh, hell. I believe in God. I don't just believe in God. I know there is a God. I have been touched by God. I remember the day it happened. I'm not saying that I can recite the Bible and that I'm overly religious. That's not what I'm saying. What I'm saying is I know there's a God. You can't convince me otherwise. And if I stand in an auditorium full of atheists and saying there is no God, would I say, yeah, you're right, there is no God? No. You put me in an auditorium full of neurosurgeons, orthopedic surgeons, pharmacists, pharmacy companies, whatever, and I'm the only chiropractor there. And we've got a patient on stage with a list of symptoms, and I've got their x-rays. Guess what they're going to get? Guess what 1,000 of those people are going to hear? The chiropractic freaking message by the chiro priest. I will preach that loud. hard and loud. Matter of fact, I will probably be louder and more belligerent and more obnoxious than I would if they were chiropractors. They're going to think that I've lost my damn mind. Would I change my communication? Yeah. Yeah, I'll change it. I'll make it louder. I'll make it more clear. And I'll say it to more damn people. Listen. This is the problem with our damn profession right now. This is why the chiropractic schools are failing us right damn now. Because nobody wants to be a freaking chiropractor anymore. I put this post I did a video the other day about the difference between cash and insurance. And the reason I did that, there's so many chiropractors out there and I get what they're saying, that they play the insurance game. They only accept what insurance pays. Well, they only pay for 12 visits, so we'll always see you 12 visits. That is so freaking disrespectful. This question, would you change your procedures or change my procedures? Hell no. If you practice in an area dominated with allopaths or public perception, what the hell? And the job market, where people expect quick fixes, how do you overcome society's like, I don't give a shit what society expects. They come to see me. They walked in my office. They walked in your office, gang. Damn it. What do you mean? They're going to come in. They're going to walk into a doctor's office. They're going to walk into the doctor's office. Sorry. Let's change it. Let's say that your sister or your brother isn't a chiropractor. They're teachers, but and your father's a chiropractor. They've been getting adjusted their entire life. And they go to their medical doctor and they're going to tell their medical doctor that they need to practice more like chiropractic, or the orthopedic surgeon or the neurosurgeon. Do you think any of the allopathic medical professionals are concerned if somebody comes in that's been seeing a chiropractor? Hell no. They don't care. So why should we? No, I'm not changing my procedures. No, I'm not changing my message. I'm going to tell them the damn truth, no matter who it is, where I'm at, what's going on. Public perception, the only public perception is what I tell them it is. They're going to believe what I tell them to believe. And if they don't want to believe it, there's the door. And that's being a master. Again, like the master of Kung Fu. Do you think someone walked into Bruce Lee's dojo and said, Bruce, I don't believe in the way you're teaching, and I think you're wrong? No. You think Fred Barge cared or Gonstead? Let me ask you all a question. Here we go. Someone walks to Clarence Gonstead's office back in the 50s, and they were allopathic, and they tried to convince him that his model was wrong. How do you think that would go over? Why are you any different? You're not. All right, I'm going to let it go. Thanks for putting up with that. Adjusting fears. Those who are afraid of manual adjustments. That's not your problem. Be great. Be a master. Be absolutely a master at what you do, and the fear will go away. Just tell them, face down. I had a patient so afraid one time that she was literally shaking. Her hands were sweating. Her face was white. And I just took that atlas and went click, and I set her up. And she went, that's it? Yes, ma'am. Well, stop. The patient where vertebra just won't move, dish or anything. Okay, so that's a good question. Listen, you're going to have those patients if things just don't move. Something will. And if it doesn't, then just hold tension and qigong. Just put motion in the area. Energy, intention. Put energy, love, motion. If it moves, it moves. It doesn't, it doesn't. You're going to have those patients. I have those patients. No outcome, no worry of outcome. Just simply put energy in the area or find a bone that will move. If the listen, I've got patients who have got spinal rods from their sacrum to their all the way up. So I adjust the atlas. I mean, what else are you going to do? Get motion somewhere. Adjust the hips and the shoulders and do a little cervical distraction. Do something. But if they're not moving, put energy somewhere. But I've got patients with spondylos that are in their 70s and 80s. They've got like grade 4s, and I put my hands on the most posterior, and I just put a light amount of motion in, they get better. Because I touched them with a loving intention. Just do that. Let's not get caught up on it. Don't think that you have to fix it. It's not your job to fix it. It's your job to be present with it. Yes. Last one on here. The hypochondriac patients, the one that everything is wrong, everything is bad, blah, blah, blah. Don't allow it. Don't allow it. I had one tonight, it was kind of funny, and I told her, she's been a patient for a long time. And she came in and she said, she wanted me, and I adjusted her, she had a headache, and she said her sinuses were bothering her. So I do the sinus points with the Pointer Plus. And I've done this with her for years. And she goes, Doc, not the ears, I don't need the ears. Okay. And then so she leaves. About 10 minutes later, she comes back in and she goes, all right, do my ears. I messed up. And I just started laughing. And I said, you know, I'm doing a class tonight on the difficult patient. I'm going to talk about you. It cracked her up. I said, she goes, you knew I was going to come back. And I said, well, I knew what you needed. I said, but it's not up to me. I said, I'll tell you the truth. I said, I knew that's what you needed. I don't know. And she goes, I know, I just hate it. I know. I adjusted her ears and don't let her out the door. It's just kind of funny. You're going to have those patients that worry and complain about everything. Do not participate. Do not participate. Listen, I'm going to start a whole new series called Master the Moment. Master the Moment. And I want you to spend time with it. If you guys are writing notes or something, I want you to put it in your notes. And I want you to spend time with this. What does that mean? Right now. Right now. Become a master of right now. Now, you may be at any particular moment speaking. Master your words. You may be listening. Master your listening skills and interpretation of what's being said. You may just be in a room full of people. Master your posture, master your body language. Adjusting, maybe master that. You may have somebody ask you a question. Master the skills of articulating your message. Master your emotions, your feelings. And listen, here's why. This is why I hired a coach. Obviously, you guys know me. I'm very emotional. I get wound up about shit. The group that I'm a part of, it's called Warrior Sage. And I loved it because we have the warrior and then the sage, right? There's a saying, it's an old saying, it's better to have a warrior in the garden than a gardener in the war. We all have it within us to fight, and I promise you do. Take your wife, your husband, or one of your children and put them in harm's way, and you fight to save them. I guarantee you, you're going to see an animal that you didn't know was buried deep inside of you come out. We all have it. But then we're also called to be loving, caring, empathetic, all these things. So in all things, we need to become masters. Now, I have worked so hard to master my technique, but it comes from, like I tell you guys, what we do is not as important as who we are, because who we are will be a reflection within what we do. Yes? If the water is muddy, you can't see your face. If it's crystal clear, beautiful picture. You see the sun, you see your face. Clear the water. Master the moment. We're going to work on that. All right? I hope tonight was powerful. So, now I'm going to go back through and I'm going to see if there was questions that I missed real quick. What about the one that wants a refund from a prepay? I answered that. Write the check, give it back, go to the next patient. Don't even give it a second thought. Okay? This is not a mistake. Yep. Let's check it. You know what? The greatest 1, 2, 3 words. Let's check it. Let's check it. And then they'll keep on and on. And I've said this before, and you don't got to be on the patient, but I've said this. Jerry? Well, it wasn't Jerry. It was a young female patient. I can't help you until you lay face down. Until I check it, I don't know. I don't know. And then here's another one. I don't know. Let me check it. Well, doc, blah 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 blah. I don't know. Let me see. Let's check it. Charles, what did I take before getting on here? You know what? I'm in love with life, man. All right. Oh, and you know what? Listen, guys, I'm going to say this again. Don't be offended about instrument. I know some of you do instrument adjusting, and I'm not against it. Don't get me wrong. I'm not. I know. He passed away. We had a doctor here in town that passed away here recently, which is kind of crazy. He got some kind of weird thing, but he was seeing, at one time, he was seeing 600 to 700 patients a week activator. But here's what he told me. I spent time with him. Here's what he said. He took x-rays and he goes, I don't do the activator protocol. He said, it takes too long. He said, besides that, it's ridiculous. I look for subluxations, misalignments, and restrictions in the spine. Instead of using my hands, I just use the activator. But only he was charging $19 a visit, 600 visits a week, whatever. But he was helping people. I'm not against it. I just don't like it. I have my own personal feelings about things. I don't like smoking. You'll never catch me smoke a cigar or a cigarette, ever. I'm not going to take a damn vaccine, ever. I will never take a cholesterol medication or high blood pressure. I won't do it. I won't use an activator. It's not to offend you. I'm just voicing my opinion. I'll get off of it. Love you guys. Derek, in an office with multiple docs and a patient speaks negatively of one of the doctor's adjustments, what a great response. Oh, hey, I love this question because when Dr. Adam, when he first started with me, about 7 years ago now, it's kind of crazy, he was right out of school. He didn't know what the hell he was doing. And I would have patients complain about it. And they would say that he was too gentle or he wasn't strong enough or he didn't get it to move like you do. And I would simply say, listen, he is much further advanced than I was at that age. When I was where he was, he's a lot better than I was. You're kidding me. No, he's going to get this. He's a great guy. He's going to figure you out. I've had all these years to learn you. It's just going to take time. I never, ever, ever say anything negative about another doctor in the office. You want them to come back. Support them, promote them, let them know that it just takes time sometimes to get the joints to move. Always, always do that. Great question, Derek. I'm glad you asked that. All right. Is that everything? Is that everybody? All right. So listen. I hope that is all. That's all the questions I'm seeing. Let me make sure. I'm going to refresh it. All right. Okay. So gang, I think we got it all. Answered all the questions. So last thing. Focus. OKC is coming up. Hang on. Is there another question? No. Okay. You're welcome, Andre. Thanks for being on here. All right. So listen. Our next Tuesday night live is July, and we're going to do it July 8th, all right, the second Tuesday. But we have Focus OKC. We have the adjusting class on the 24th. I'm going to take it to another level. I've made a decision. What I've done is I've taught the same, and it's going to be technique, the same thing, but mastering the moment. I'm going to spend more time on this. I think it's one thing to know how to locate a bone and move a bone. It's another thing how to become a master of the moment. And that's what we're going to work on. And that's February the 24th. Gang, listen to me. I know some of you are on the fence. Get your asses to focus this year. Commit to you. Commit, bring your teams, bring your family. I don't want to hear that you don't have time. If you don't have time for your practice and in your future, what the hell do you have time for? Now, I know some of you have weddings and some of you have already planned trips. I'm not talking about y'all. I'm speaking to those of you who are just not going just because you just, it's bullshit. I'm going to call you out. This will be the very best focus we've ever had. This will be transformational. Listen, you guys understand, Amy Van is going to be speaking. We have, my brain is crazy because I'm crazy. We have several. Landon is speaking. Raquel is speaking. We have several foundation members that I've got speaking at this event this year. And the reason they're speaking because they represent all of us. Foundation doctors. They are gonna and then everybody else. So just I'm gonna get off my horse, but damn it, come on. It's time to make a commitment. Time to make a commitment to what's going on. Let's get more involved. We don't have, listen, I was part of a coaching group that we had 5 meetings a year. We don't have that many. We have a workshop in the spring. We have a workshop in the fall. We don't have another workshop until November, gang. Get your asses to focus, all right? Last thing, schedule your coaching calls. Reach out if you need anything. Know that I love you. I care about you. If there's anything that you need from me, please reach out. Have an amazing evening. I'll talk to y'all soon. Night.